So we covered quite a few topics related to this. So last is kind of crisis and emergency situation, not to the patient, but to the practice and the doctor. So how do we handle this? I think we have to be prepared for that also, because it recently had two extreme incidents, very shocking, brutal incidents. It should not come to us, but we have to be prepared. So that's all about crisis management. Be prepared and stay connected. Right. So we talked about golden hour in MI, and we all know golden hour in RTA. And this is golden hour in attack on hospital or any crisis. Not necessarily the attacks we see in the social media or TVs. So it can be subtle form of attack. Somebody, a group threatening a physician or a staff. So it actually starts in a small scale, and due to some elements it escalates into a crisis situation. So this is a pressure cooker situation. It can burst, it can settle down with few whistles, right? So basically these are the inciting causes. So the doctor generally is in a state of shock. We can handle any human ophthalmic emergency, but general emergency or these kind of situations, most of us in the shock. And particularly when it escalates to press or social media or police, and versus the political splinter groups and agitation. So all this becomes a pressure cooker situation. This was our state few years back, but now the roles are reversed. So we are blamed for every disaster, and attacks can happen, and attack not only on the staff, on the equipment or on the premises, but also on the reputation. This attack on reputation is ongoing. So it's actually increased in the last few years with the advent of social media and Google review, Facebook, Insta, all those things. Even our stakeholders like insurance companies, the aggregators have taken this route to slander us. So basically, crisis and emergency situation may be structure induced, right? Infrastructure difficulties, process induced, staff spilling something, and doctor induced, drug induced like anaphylaxis, self inflicted can happen, right? Handling a mentally disturbed patients, or a mob violence like patient or family. So this is, yeah. So most of us, we don't realize our strength, weakness. So generally, when we don't have the infrastructure to meet the patient requirement, we should not take over and above our capacity. So never take patients beyond the scope of our specialty, and ensure equipment, drugs are available, and errors of counseling or communication. Generally, our staff tend to paint a rosy picture. They always give 99.9% or 100% no errors like that, or over promise. So this is where we get into problem, and not following the consent process. So it's always important we document all those things. Staff induced, generally they will act in front of us, but they may not be complying the instructions. So wrong site, wrong route, wrong drug, wrong eye, all this have happened. It will continue to happen if we don't monitor the situation. And rough handling of patient and relatives. So most of our patient relatives, particularly the new age attenders, are very touchy and finicky. They have a huge ego when they come to a hospital. So they want to record everything. So they are very suspicious and a bit biased. And any wrong news, that's exaggerated, right? And somebody working in the theater or any area where this emergency happened, if they come over, they can spill the beans. And complications, I think we have discussed enough. I will not go into the details. And so basically, we have to face the crisis as well as prevent the crisis. This is more important. Preventing the crisis from escalating is very important in crisis management. Avoid the crisis, right? So there is a huge gap between our perception of running a practice and the way the staff do. So you have, and as well as the patient expectations. So we have to bridge the gap. So ensure these 4Ps are important. So we have to handle these 4P diligently: police, press, politicians, and public. Right. So when they need us, they will shower flower petals, but when they don't need us, they can extract in many ways. So the first one is liaison with the police. If there is a death in the hospital or a crisis in the hospital, the general demand is arrest the doctor. So basically section 304A. So generally what happens is we have to handle this with the help of our associations or a group of doctors. So talking to the higher authorities really helps. So in many incidents, we have talked to the superintendent of police or the higher ups like the ADGP or DGP and averted the crisis. So instead of dealing with the local police, always escalate to the higher level. And liaising with the press, particularly on table death or any other crisis, it's always better the owner or the staff or doctor is directly not involved with the press. So ensure you work with IMA or any other even ophthalmic association, and ask the office bearers to brief the press. So that will clear the doubt. And generally press reacts favorably when the top doctors are involved. So their ego is also a bit brushed up. So when the top brass come to them and talk to them, most of them it is settled. And this is the most difficult group, particularly it's basically a splintered political group. The large groups have their own TV, media, all those support system. And when they get involved, police are reluctant to take any action. So a general rule is talk to the top brass, as well as call to the political group, call them to a room, talk to them in a separate room. So highlight the situation that this is not a complications or not negligence. It is part and parcel of medical care. We'll try to help the patient and the family as far as possible. So this is very, very important. So if you have a staff like PRO, this really helps. You can train them and he can manage the situation. If not, we have to directly get involved, ensure that we take a professional help from the association. So for this is very, very important. We have to avoid professional jostling and talking ill about our colleagues. So this should be avoided. That's one of the reason local bonding is very important. And you have to set in certain process and protocol even for crisis management. We call it as code gray. Some other hospital will give a different code, but code gray is the general term for crisis management. So you have to learn from the mistakes also. What are the prevention measures? How to be prepared for this? So this has to be a continuous event. At least once a month, we have to discuss about this with our staff. So you need to stay connected, and need of the hour is because the incidents are raising. So we have to be working with our friends as professional colleagues, working with the association. We have to be active part of association, so that there is a crisis leadership that is really there to help you. So thank you so much for your kind attention. If any questions, we'll be happy to take.